Claudia and today I'm going to demonstrate some sharp debridement skills on this ham hock specimen as shown. I've just washed my hands and put on some gloves. The first thing I'm going to do is a wound tracing. To begin with, I'm going to start with the initials of the patient in the top corner, the date, and then I'm going to also do some orientation, so put the 12 at the top so I can orientate the tracing to the drawing. So then what I'm going to do is I'm going to place the plastic bag over the wound and trace the different structures of the specimen. So as you can see, I've traced all the different structures and labeled them with B for bone in the middle, necrotic tissue, which is the green spot, the muscle around the necrotic tissue, and the crosses here symbolize the connective tissue. So direct tracing. The next thing I'm going to do is do a measurement. I'm going to do one from both the specimen and off my drawing. So basically I'm going to use the metric system, which is in centimeters, and I'm going to measure the surface area of the necrotic tissue, which is the longest width by the longest length. And then I'll do the same on the tracing. And then I'm going to calculate the surface area by using the 2.8 times 2.5 centimeters. And then I'll do this to work out the centimeters squared area, and then I'll do the same for the tracing. As you can see, the numbers are slightly different, so it is important that slight differences, so it's important that whenever you are comparing them, you're comparing either the specimen tracing or the tracing measurements to each other. That way it's more accurate. So I just calculated the surface area measurement from that. The specimen one has 7 centimeters square of necrotic tissue, and my tracing actually has 8.41 centimeters square of necrotic tissue. So there's quite a significant difference between the two. Next, I'm going to demonstrate some shaving and paring. So I've got the 10-inch scalpel, and it's got the flat end, and on the red spot here I'm going to shave off the callus with some small sawing motions. Now the way I'm holding it is through my third and fourth finger, and I'm going to do some small shavings just off the top surface. So just a really thin tissue which is transparent in the light. And so there's only a really small colour change, so it's a little bit more light pink. So making sure that I don't go very deep to ensure that I don't cut into any viable tissues. So I'm making sure that my elbows and forearms are well supported, and I'm doing all the work with my fingers and my wrists. As soon as I've done a small cut, my blade flattens out. So as you can see, the dye has just turned a little bit lighter, and here are all the shavings which I made. Okay, next I'm going to demonstrate some cross-hatching and scoring techniques, and for that I'm using the number 15 scalpel blade, and I'm going to hold it like a pencil, so where the back part is resting in my web space for lots of support, and my forearms will be supported by the table. I'm going to do perpendicular lines and parallel lines, making sure, and I'm going to use the round part of the blade, not the pointy part. So I don't want to go too deep, so I don't go into viable tissue, just so it gets to a little bit lighter green. So if you can see the small scorings across the surface, then I'm going to go perpendicular to those parallel lines. Same technique. I don't know if you can see that line slightly there. Now, I actually want to do one deeper cut to see what it feels like to go too deep. So I know this is incorrect, but I want to see what it feels. See, yeah. So there I went into viable tissue, and the patient would have felt that. So that's incorrect, and I did that purely for the reason of learning. Okay. The next technique I'm going to demonstrate is debridement of the stained muscle tissue, which is on my specimen the green stain. And I'm going to do that with the forceps and the scissors. So I'm going to hold them correctly, so through my thumb and my ring finger, and I've got my pointer finger to support the top of the scissors. And of course I've got a firm grip on my forceps. So the hammock is fairly stable on its own, which is good. And what I'm going to do is just pick up small shavings of the necrotic tissue and cut them off with the middle third of my scissors. And I'm going to keep going until I think I've removed enough of the necrotic tissue before going into viable tissue. While I'm removing some of the necrotic tissue, I'm also making sure that I don't go dig the tip of the scissors into the tissue. That I'm going parallel to the wound bed, and this is again to stop any further pain or injury to the wound. I've been removing the necrotic tissue for approximately about 10 minutes, and I've removed a fair bit of the top layer. I've decided to stop there. I think I'm very close in contact to the viable tissue underneath. In fact, I believe at this spot here, I may have gone even a little bit too far. So it's a nice learning experience for me to know exactly when to stop. And so, along with other cleaning agents, I believe this is enough debridement from this muscle tissue.